So what is PKD? PKD is polycystic kidney disease. So as the term implies, polycystic means multiple, cystic means multiple cysts. So cysts are fluid-filled sacs, and there's so many of them. There's hundreds of them on both kidneys, and the kidneys become enlarged with time. They usually start with a small number of kidney cysts, and then they grow in number and in size. And the kidneys become as large as an American football. And so polycystic kidney disease, or in short PKD, is this inherited kidney disease. It affects about 1 in 1,000. So there's about 600,000 patients we estimate in the US, maybe a little bit less. The main two types are autosomal dominant polycystic kidney disease and autosomal recessive polycystic kidney disease. So AD-PKD and AR-PKD.
My relationship with PKD kind of started with my mom. She had it, and knowing that the disease carries to 50% of your offspring, and just kind of given some of my personal history with UTIs, kind of flank pain, I kind of had an idea that I may have had it. I was diagnosed right before my 26th birthday.
So what is AD-PKD? AD-PKD, or autosomal dominant polycystic kidney disease. Most of the times there's going to be someone in the family who has PKD. So about 80 to 90% of the times, someone like a parent, grandparent, has polycystic kidney disease, and it leads to multiple cysts, hundreds of these cysts in both kidneys, and then eventually, and unfortunately, the kidneys fail to function. So with time, they're going to grow in size, and then with time, they're going to lose function year after year, where the kidneys won't be able to function enough, and then we will have to resort to either dialysis or kidney transplantation. Our patients with AD-PKD are born with the disease. Now, fortunately, there's no manifestation of polycystic kidney disease in childhood. Mostly it starts showing up with symptoms and signs and feeling of PKD later on in adulthood.
When I found out I had PKD, I didn't have any symptoms. I didn't feel anything. I was actually laying down in bed. 40 years old, I felt a mass on my lower abdomen. And of course, they turned me upside down. They did an endoscopy, a colonoscopy, and they found out that I had a lot of cysts.
With AD-PKD, typically we have high blood pressure, so hypertension. It can start early on in teenage or early adulthood, so it's important to check blood pressure. There's also sometimes it comes to light when there's symptoms like pain, so flank pain or back pain right below the ribs where the kidneys are. They might have some acute pain or chronic pain. With acute pain, it could be bleeding, so they might see blood in the urine, or they might just have a lot of pain and then they go to the emergency department and they get an imaging like a CT scan, ultrasound, or an MRI later on.
When I'm reviewing a CT scan or MRI in a patient with suspected polycystic kidney disease, I will look first for the presence of renal cysts. That sounds obvious, but it's important to look for bilateral renal cysts that are simple and involving both kidneys in a symmetric fashion. Also importantly are other findings we could see on CT or MRI that might cause a patient's symptoms. Some patients may have stone disease or obstruction. That's important to look for. Patients who have PKD and have pain in the flank could have bleeding into a cyst, that's not uncommon, or enlarging cyst or a ruptured cyst. So those are the less common things that can happen in a patient with known PKD that could account for symptoms.
So any kidney infection, cyst infection, where there's fever, burning when you pass urine, a lot of pain, feeling unwell, that could be also an early sign of PKD. Now with PKD, there also could be many other manifestations outside of the kidney. These cysts can affect other organs, such as the liver. It's very common to have few liver cysts, so those are kind of similar process. Now fortunately, even if the liver is very enlarged, the liver function does not get affected. So mostly we'll have just multiple hundreds of these liver cysts with no effect on the liver function, but it can cause chronic pain, it can cause difficulty breathing, it can cause nausea, heartburns, not able to eat, and malnutrition. It's a lifelong disease, and it's a multi-system disease, so it affects the kidney, liver, brain aneurysm.
So I've tried to raise my girls with a healthy respect for PKD and the seriousness of the disease, because it is a chronic and lifelong illness. But I've also tried to help them learn to live with it, living alongside them, like the color of their eyes. Letting them learn what it's going to take to prolong the progression of their disease and things that they can do every day, but also how they can cultivate joy in everyday activities.
We can treat polycystic kidney disease much better now as compared to 20 years ago. We understand it much better. So how do we treat polycystic kidney disease? So everybody, even if they're mild or severe, we treat the blood pressure. So it's important to check the blood pressure very regularly. Then there's the healthy weight. So it's important to stay as healthy in weight as possible. So there's the body mass index, should be close to 25. The third thing is to drink a lot of fluids. So polycystic kidney disease, these cysts are stimulated by vasopressin. It's a water thirst hormone. So if we are thirsty, there's much more of that vasopressin released from the brain. So the less thirst you have, the better. The other thing that's important is to identify a group of patients. Those are about 2/3 of AD-PKD patients who we consider at risk of rapid progression. So if we think that you're going to reach kidney failure by age 65, we want to do everything possible to delay that and slow your disease process. So how do we do that? There's right now one FDA-approved treatment called tolvaptan, or Ginarq. This medication is a twice-a-day medication. It blocks the effect of that thirst hormone or water hormone, vasopressin. It blocks the effect of that hormone on the kidney. Unfortunately, we don't have a cure yet, so we cannot reverse it and we cannot stop it completely. So the more you know, the better, which means understanding what your total kidney volume is, understand or try to see if you can get a genetic testing to understand also your risk. It's one piece of the puzzle. The more pieces of the puzzle to give you your picture, which is very individual, very different from other family members with PKD or other PKD patients who you might have heard their stories, the more you can get your own picture, the better.
As we move into our aging years, we're encouraged, right? We're like, hey, this can be an incredible thing if we take care of ourselves, if we eat the vegetables and stay healthy and exercise and find the good doctors and manage it in a way that you're empowered. The doctors can do so much, so it's now up to me to take care of my body to make sure I'm giving it every advantage so I can have a long, productive life.